The Bondi Clinic has just received a call from a worried babysitter who's looking after a friend's turtle.
And her golden retriever's actually picked it up and bitten through the shell.
I'll head over there now.
Thanks, Chris.
Okay, it's all right. Hello.
Hello, how are you?
Going?
Yeah, good,
You got a turtle?
Yes.
Yeah, all right. Where is it?
Right, upstairs. Come on, thank God you're
I'm
here.
Chris.
The dog took a liking to the new family member and thought he'd have a little taste. And he's put a few holes in him.
Is this him begging?
That's just him wanting attention.
I think it's him wanting something else, actually.
Homer's
him wanting a
owners are
second
away
go.
for 3 weeks. This is the turtle's very first day in Jodie's care.
It's very clear that Coda is absolutely obsessed by Homer, and when he saw his chance, he took it. There's 2 big puncture wounds here, but also he's had a few little goes here trying to get his teeth to grip into the shell.
Oh, well, I nearly threw up, to tell you the truth. I didn't know where to go, where to run or who to ring But we decided to ring Bondi Vet.
No, don't beg. It demeans you. It's not a good look, Coda. If that tooth has gone right through, that goes straight into his lungs. My biggest concern is really twofold. How much damage have Coda's jaws done to Homer's internal organs? And then infection. A dog's teeth carry a lot of bacteria. If they've been forced in underneath that shell, we could be looking at a really serious problem here.
I think she's got some head fractures, so we'll just get her out and make sure she's breathing okay.
At the Bondi Referral Hospital SASH, 5-year-old Betty has arrived with shocking head injuries after being run over.
Goodness me, that's definitely a broken jaw. It's just crunching under my fingers.
This just looks absolutely horrendous. I mean, this little cat's skull has been crushed by a car. I think she's got broken jaw. I think there appears to be fractures possibly around her eye as well. Her whole head has basically been squashed.
Owners Linda and Max are heartbroken.
We couldn't have children. She's the daughter I never had.
Brain injury and vision loss are the major concerns.
So we have to really look at those injuries that she's got to her skull and also have a look at if she's got any injuries in her chest, because if her head's gone right under the car, you know, it's possible that her chest has been squashed as well.
Betty urgently needs full head and body scans.
She's our baby, so go ahead.
Okay.
Whatever it takes.
He's at quite a bit of risk of infection here. So I just want to scrub around here and just see if we can remove a few of the bugs that are around these holes here.
Homer the turtle is lucky to be alive after finding himself in the jaws of the playful Coda.
Keep on circling, yeah, Coda. You got to feel for Jodie. She's been put in charge of Homer, and all of a sudden, the worst possible scenario has unfolded. Coda has bitten into Homer and left 2 big bite wounds. When I push the forceps in, we're actually losing them in there. There is a hole in there. Homer's been lucky in one way because one of those bite wounds hasn't penetrated into his lungs, but the other one is quite deep. And that's the one we're going to have to pay very special attention to make sure an infection doesn't develop. There we go.
A shot of antibiotics will help fight off any infection, but Chris is also worried about another nasty injury.
He's also got this big crack here. Was that caused by Coda as well?
No, that was from a fall.
Okay, so he's had a fall before this,
Yeah.
not with you?
No, since my little friend down there's had a go, it's, worse.
This needs to be fixed though, because you can see each time it drops down, it pushes into his neck, which is going to really inhibit how well he can breathe, and it's going to get in the way of his leg as well.
Chris needs to take Homer back to the clinic for some structural repairs.
Can it be okay without him? Probably going to enjoy the lack of responsibility for a while.
Oh, get out.
Another wee.
Better you
definitely need it waterproof, so the aqua's going to be the go. Okay, good stuff.
Chris and Homer
Thank you.
have made a detour on the way back to the clinic for some unusual medical supplies.
The boat repairs. It's close enough to a boat, isn't it? Got a special one for you. Meet Homer. Homer's been chewed on.
Oh, it's not your regular chew toy.
On his
No, it's
first
not.
day
So
as
he's
babysitter
got a
Jodie,
tooth mark through
Homer
here.
found himself at the mercy
And
of her
here.
golden retriever Coda.
He's got a big crack here. If he was to tear that off, it's just going to rip his whole neck right open.
Oh, poor baby. What the heck is that?
Yeah, it's for boats. Boats go in the water.
Turtles go in water?
Makes sense, huh?
Yeah.
The game plan is to use this putty to put across that crack there, and then once it hardens, it'll really lock that bit of shell in place. And the important thing about this is it's waterproof. So once he is better, he can actually go in the water and not worry about this falling apart.
The putty Chris is using is non-toxic, but this is a job for the professionals.
Got me. It's been taking too long, and he wants it over. Sounds good.
With the panel beating finished, Homer can now take his shell for a test drive.
Come and get me, big guy. Come on. Yeah. Oh, jeez.
Homer's definitely on the move and on the mend, but the wounded reptile will be kept under watch at the clinic to ensure the antibiotics have stopped any infection from Coda's teeth.
Not sure if it's a good thing or a bad thing. You actually can't see my handiwork now.
All right, Bubby, let's see if we can do this scan.
5-year-old hit-run victim Betty is about to undergo a CT scan to reveal the extent of her horrific facial injuries.
If you think of the size of a cat's head and the size of a car and the car going over the cat's head, squashing her face, her brain has got to have had a bump in there as well. So whether it's just a mild concussion or some more serious brain injury, only time's going to tell. There's the jaw fracture. Just there, you can see her lower jaw has basically been split in two. The two sides of her jaw are basically working independently of each other and just hanging there in space. It's got to hurt.
Oh, sweetie.
Incredibly, Betty's chest and other internal organs have not been damaged, but the much-loved pet is just hanging on.
Hello, princess.
Linda's bond with Betty is really special because Linda's actually had health issues herself, and Betty's the one who sat on the bed with her and helped her through her problems.
Betty looks after wife, if wife's a bit crook sort of thing. They seem to understand each other. If Betty's a little bit off colour, Betty goes to wife and vice versa.
This is a tough situation for everyone. Betty is a mess. She's got a fractured jaw, she's in shock, and we can't give her an anaesthetic now because if we do, we could kill her. This is just one of those horrible catch-22s.
Fingers and toes. Please cross your fingers and toes too. And now we've just got to wait and hope.
The next day, Chris has an appointment at the Randwick Racecourse, joining the team of on-course vets.
How you going today, Jimmy? All right.
It's his first time, but he does have some family history.
My great aunt was a pioneer. She was actually the first ever drug tester out here, but ruffled some feathers because she got a few positives. So just hoping out here they're going to welcome me today. Let's see.
Heading the team is Chief Vet
Good to see
Craig
you.
Suan
Brown, nice
and
to see you.
Chris's old uni
Hello,
mate
Christopher.
Mark
How are you?
Shembrook.
I'm a bit worried, Doctor. Back in the university days, Chris around a horse made me very nervous. So I hope you've improved since then, mate. Do you know how to take blood from a horse?
Horse has got veins. Yeah.
That's a good
I'm
start.
sure of. It's going to be okay.
So we better get stuck into it.
Okay, no worries at all. So I've been instructed by the stewards to get a pre-race blood sample.
Oh yeah, no problem.
Is that okay?
Please carry on, yeah.
No worries. This is number 6 in the
Yeah,
first.
that's right, yeah. Larky.
Is this one in the first as well? I'm not testing you. You're okay. You're a very good bet, though. You're every chance in this first race, I promise. Hey, buddy. It's a little prick. It's all right. It's okay. It's okay.
Boy, good horse.
In these pre-race samples, we're certainly looking for things like stimulants or anabolic steroids, but one of the most commonly detected substances is bicarbonate of soda, the same stuff you buy in the supermarket. And it's meant to buffer all that lactic acid that a horse produces during a race and means they can run for longer and ultimately run faster. So they've all got the same number, B067779.
6 vials of blood will be taken and tested for a range of banned substances.
So we'll go off to the lab now and get those results in about 10 days.
Perfect. Thanks very much.
No worries at all. Good luck.
Chris is now heading out where the real action begins.
You keep your eye on things, Pete.
Vets are required to be at the barriers for the start of all races, in case one of the thoroughbreds gets hurt or is deemed not fit to race.
Riding or not? Yes, no.
I'm actually quite nervous about this race because 2-year-olds are notorious for being difficult in the barriers.
We're chasing him, Charlie. Hang on, yeah.
It's new, it's foreign, it's scary for them. Anything could happen.
Come on, come on.
I don't know how long we can leave.
Yeah, I
these
know. It's
things
getting
for.
to a point where we've got to, if she's stable enough, take a calculated risk so we can get this side of it done.
Surgery on Betty's shattered jaw has been scheduled today with specialist Andrew Marchevsky, but in the past 24 hours, Betty's condition has suddenly deteriorated.
You know, she became so anemic so quickly. I think if we'd have operated when she first came in, you know, she'd have died on the table.
All right, darling. We need to get you sorted, don't we?
The trauma case is always a balancing act. There's never a perfect time to do a surgery. You've just got to be a time that's the best given the situation.
Oh, good kitty.
That is your plan. You need to work towards
I have to make it look
this
like that
face.
again.
Now that you're a qualified cosmetic surgeon
Right.
for cats.
Yeah, I'll make it look better than that.
So we're just going to, first of all, stabilise her jaw so it's nice and solid. Get her occlusion, so alignment of her teeth right. And then once we've done that, we can then suture all the skin back onto her mouth. So it's a bit nasty.
You can make a jaw heal any way you like, but it's very unforgiving. It's got to be pretty perfect.
So you can see that tooth there is fitting in nicely just in that right spot there. Yeah, I do a pretty good job.
She still probably has some potential brain injury there. So hopefully now we've got a facial trauma controlled as much as possible with this surgery. We'll be able to really see what her brain's doing.
This is the only one to start, so this will be fun and games.
Righto, Lance, give him a call, mate.
At Randwick, a 2-year-old race is about to begin, and the novices are making everyone nervous.
If I see a problem, I just yell out to you, the starter, and
Straight in, mate. Jay Ford, be ready to go up after him.
Worst case scenario here is if a horse actually goes through the barriers or rears up. If they do that and they get something caught, then I could disqualify them, and that's a big deal around here.
One up the mile.
Suddenly, horse number 8, Mandalon Court, spooks and takes off from the barrier.
It's got one that's bolted off down there.
Yeah, and the saddle might have slipped too. We'll have to check that one.
Wow, it's moving. He'd win races with that sort of speed, but he's going the wrong direction. You see that Clark, the course, has gone off to chase this horse that's raced off. The concern is this horse may not actually be able to race a normal race, so it may be scratched now.
We're having a look at it right now. They said it went hard. Did it go hard, Chris?
He's got a really fast heart rate there, and also he's sweated up. You can see the veins all across his skin there. My feeling is he'll be scratched.
He just got a bit stage fright and decided to run his race a bit early.
Mandalong Court will be scratched by the vet.
Righto.
We got him here for some reason, not just to stand around and look good. He's got to do a bit.
Now the vets are hoping the rest of the runners can get away without any more trouble.
Just got one just shifting in here now.
Hand down. Righto, ready when you are. Be ready, Jim. Straighten them up. Well done. Well, it's all go, isn't it?
It is, yeah. It is all go. It seems like we're picking on you today.
Oh, it does. It's very suspicious.
So I just need a urine test from you.
It's been a hectic day for Chris at Randwick, and his vet skills are about to be tested one more time.
you need a urine test after the race, you can't just walk over to the horse and say, hey, pee in the jar. So you need to whistle.
Surprisingly, racehorses are trained from an early age to urinate in response to the sound of whistling. So the testing can be carried out efficiently.
That's probably enough. It's all in the whistle. Thank you. Okay, I'm wearing gloves. So they're tamper-proof now.
Have you learned a lot today, Dr. Brown?
Shambury, I have, and apparently your job here is looking very shaky.
That's okay.
Very shaky. I was short price favourite to fail today, but I've come up okay. So I'll see you next week. What the conversation we had before about me being now the new vet.
Indeed, look, for sure. Yeah, I think, yeah.
No, Doctor, he's not replacing
No, he needs more practice.
Great day. That's a success. Thank you.
None of this.
Thank you. Thanks, Peter.
Thanks, mate.
Great to work with you guys. See you all next week. All the best, Mark. You'll be fine. It'll be great. Some kennels need some cleaning out at our work, actually, if you want to do that.
Betty! Are you
Brave
talking?
Betty has made it through the surgery
so beautiful.
to reconstruct her shattered jaw.
And come out?
The tough cat headbutted a car and lived to tell the story of her incredible escape.
Oh my goodness. Practically jumping out. Hey?
Her jaw's healed nicely, she can see, and most importantly, she doesn't appear to have any brain damage, which is just fantastic.
Hey. Oh, my darling girl.
Hello.
Look, you've even got
For Linda and Max, the ordeal is finally over.
Oh, trying to get away. Yeah, she's back to normal.
Yes.
There's been a bit of a brain transplant because she's actually quite nice now rather than aloof, so that might change. She might go back to normal.
She just won't be allowed outside. Are we listening, Max?
Right. Yeah. Yeah, no, that's right. Yeah.
Don't look at him like that.
Chris is returning the patched-up Homer to Jody. The unrepentant Coda has been banished to the balcony.
The big issue with Homer now is water, because I don't want him getting water in these.
Okay.
I don't mind if his head goes under, I don't mind if the base of his shell goes under, but those two holes can't go under water.
Homer's battle scars will take at least 3 weeks to heal, but his owners will be back from holidays before then.
I'm going to have to bite the bullet and tell them I'm not very good with secrets, especially when there's 2 big holes to prove it.
I often say it, but in this situation I really mean it. Good luck.
Thank you. I'm going to need it.
I've done all I can for Homer, but really I think the safest thing for him, let's get Coda a dog toy, one that's not living. Something not a lot of people know is that when I was at uni, my dream was always to work with the big stuff, horses, cows and sheep. But when I graduated, something happened. I ended up working in the city, so that dream was never ever realised. But this week, a mate of mine, Andrew Jackatine, has asked me to help him out in his country vet practice. So this is my big chance to put those skills to the test and see if I ever could have made it. This could be interesting. Hello.
Hi, how you going today?
How you going? I'm Chris.
Good. Oh, hi, Chris.
Reporting for duty.
Oh.
Hello.
How you
Hello,
going?
Good to see you.
Long time no see.
Mate, nice place you got here.
Like it?
It's all right. It looks massive.
The Mansfield Veterinary Clinic looks after the Victorian High Country. It's a busy practice.
But we've got some work on. Thought you might send you straight out on the job.
What is it?
Well, it's a horse with a cut shoulder.
Give it a go.
We'll give you the tour of duty later.
I'm lucky about. The one thing that's predictable about horses is they're unpredictable. This horse could be an absolute little pony, or it could be a wild kicking machine. You only know once you get there.
Oh, Chris.
Hey, how you going?
You're a long way from home.
Yeah. How you going? You're Claire?
Good.
How are you?
Good, thank you.
So where's our horse?
It's just down here.
Okay. What's her name?
Sparkles. It's on her offside shoulder.
What Chris is about to see is a lot more serious than he expected.
Boom it. It looks terrible. It's worse than what I thought it was. Rumi.
That's nasty.
Sparkles was startled by a rabbit. In her panic, she got caught up on a gate post.
This isn't just a small scratch, this is a massive open gash. I've got no doubt that if I was to do nothing here, then Sparkles would develop a major infection. And horses, they're very sensitive to infections and they can kill them. What we'll have to do is just give her a little bit of a sedation. That'll just take a few minutes just to have its full effect.
Sure.
What I'll do is just start to clean up that wound there.
No, Nick.
Considering what I'm trying to do to her, it's probably not a huge surprise that Sparkles tries to give me a bit of a kick.
Very steady. Good girl.
I just have to keep alert here because a big kick from her will hurt a lot more than a bite from any dog in the clinic back in Bondi.
Steady. Whoop.
The issue I've got with any sort of wound when it's happening in the paddock like this is that you don't really know what they've cut themselves on, you don't really know how dirty the wound is, so you just assume it is dirty and just give me a really good flush because any bacteria in here, once we close it over, will just go crazy.
Sparkles has been with Claire for 19 years and taken all her children through Pony Club.
She's just like part of the family. She's a very kind and gentle horse, and you don't like to see any animal in pain, but she's certainly done a number on herself this time. Good girl. Good girl.
This isn't just a small stitch up, this is a piece of major construction because I need to bring the muscle in underneath and then the skin over the top. It's all right.
Almost done though.
The very good news for you, Sparkles, is that is me done there.
Very good.
Antibiotic and tetanus injections complete the treatment.
For a city vet, I think he's done all right. Made a neat job of it.
You happy? Or you just sleepy? You just want to sleep? Yeah, okay. Got a nod there. I didn't realise I was actually getting watched by them, but it appears the show's over. Hey, thanks for coming along. Yeah, I'll be around for a week. Thank you. Yeah, you're going to start laughing as well. How appropriate. I'm so pleased and relieved because she looks great. And this, as a recovery ward, it's all right. Day one, horse surgery, a success. Many more days to come. Many more tests to come. Pretty modern, mate. You know, you're doing all right down here, aren't you?
No flies on us in the bush.
Earned a bit of money for you yesterday too, let me tell you.
After a hectic first day, Chris is back at the Mansfield Vet Clinic.
What else you got? Come on, what else
Pop out the back, we'll have a look at the horse area.
Oh, yeah, we got one of those as well.
One of those at Bondi?
Yeah, you bet. All right, and now you're just showing off, aren't you?
Yes.
What do you got here?
Nice little girl, little Kelly.
Kelly's leg was broken after being hit by a car.
Last week we popped the plate on the broken femur and fixed it up, so we're trying to rehab her and get her back into the wild eventually.
You get pretty much everything around here, don't you?
We certainly do, and speaking of everything, I've actually got a little job lined up for you. We've been saving it. In fact, I saved it specifically for you.
This doesn't sound good at all. What have you got?
We've got a little bonnet macaque, Ziggy, out at the zoo. He's got a couple of little problems, got a couple of little lumps on his eye.
A monkey.
Monkey.
There's no monkey.
Well, you know, we get these city blokes come out to the country. We reckon they can show us a few tricks, so we've got to put them through a little bit of a test.
Call us when you're done.
Yes, righto. We'll see how it goes.
The more I think about it, the more I'm starting to think that Andrew has really stitched me up here. Monkeys, sure they're funny, but they're notoriously difficult to catch because they're intelligent. This is going to be really tricky.
That's good.
It's part of the welcoming committee here, is it?
Yeah.
In the last week, owners of the Mansfield Zoo, Bronwyn and
I came
Dave,
out here,
have
no one
become
mentioned.
increasingly concerned about Ziggy.
He's got some little lumps on his eyes. They've been there for quite a long time, but just recently they've got really large, and it's just got to the point where we need to get them looked at because they're going to start impacting on his vision and possibly on his eyes as well.
The really frustrating thing for me is that I can't go in there with him. Monkeys carry a lot of diseases that are transmissible to humans. So if I get in there and he bites me or scratches me, then I could leave Mansfield with herpes.
Zig, come on.
So the whole idea here is to make Zig a little bit jealous of the food going on here, so he's going to come down a bit closer for us.
Hopefully, yes.
He's looking down to almost taste it. I think he really wants it.
Ziggy's favourite foods are only managing to get the attention of his neighbours.
It's pretty clear I'm being outsmarted by a monkey right now.
It's time for Plan B. The eggs and almonds are now placed in the capture cage.
Come on, mate.
Hopefully Ziggy will come down and take the bait.
He went halfway in and then ran out.
Oh.
Serious? He's in. Yeah. Now I can actually get a really good look at Ziggy's face. It's amazing how big those lumps are. My initial thought was that maybe they're cysts that have grown out from his skin there, but they could also be papilloma, so warts, or it could be a type of tumour. It's hard to know right now without actually getting in there and taking them off and getting the samples analysed.
Back at the clinic, Andrew's waiting for news on Ziggy's capture.
How'd you go, mate? It was pretty simple.
Yeah, good. I was wondering who's going to win the battle.
It's very one-sided. I'll tell you the true story later on.
Okay then.
The hard part about operating on Ziggy is the fact he has so many of these lumps, and they're also in a very sensitive area. If these were to get any bigger, or if there were to be any more of them, the surgery would be nearly impossible. This is about the last possible moment we can do it, and do it safely.
Chris is using a probe with an electric current running through it to burn off the lumps. The electrocauterisation helps minimise any bleeding.
Now we're up close to it, you can see definitely there's some quite serious irritation. There's extra pigmentation and extra coloration around the eye. There it is there. The really interesting thing I'm noticing when I'm taking these lumps off is the fact they're not really that deeply invading into Ziggy's eyelid. Normally tumours will quite aggressively push their way into the body, whereas warts and cysts generally don't. I think that's a good sign. We've taken off 4 already and you can already see a pretty dramatic difference. The tricky thing now is how much more do you do? You take off too many, you're going to cause a lot of irritation, a lot of inflammation. It may not be necessary. I think Ziggy's going to have to live with a few little lumps and he'll get by with that. I think as long as they're not starting to rub in his eye or block his vision, he's going to be okay. Zig, you actually look a lot better, don't you? It's actually pretty awesome to see a monkey this close and do something to help him as well. It's a pretty cool experience.
Ziggy's biopsies will be sent to the lab to be tested. For now, the monkey will be kept at the clinic for observation as he tries to shake off that surgical hangover.
You know that feeling you sometimes get when you wake up in a hotel room and you don't really know where you are? Ziggy's going to get that times by about 100. It's going to be really confusing and quite confronting for him to all of a sudden look around here and have no idea where he is. So they've got names?
They have. This one here we've named her Wilma.
At the Mansfield Vet Clinic, local wildlife carer Kathy has arrived with a baby wombat which has just lost her mum.
So these two are okay?
Those two are fine. We keep them together for company.
Just as sort of mobile pillows. You're a little wriggler, aren't you? Oh, you're a little wriggler. Is it because I wake you up? No? What is it then? I keep looking and looking, trying to find something wrong with Wilma, so she has to stay a bit longer. There's nothing. Wilma obviously had no luck with her mum being hit by a car, but her luck's changed pretty quickly. Kathy's going to be a pretty good adopted mum. And you're expecting?
No, we have...
So don't...
I know. We have another...
It's dangerous to just assume a woman's pregnant, and this is exactly why. Well, I didn't expect that.
Sorry to interrupt. I know you're having a lovely time with the wombats, but we've got a difficult calving, so we need you to go out there straight away, if that's okay.
No worries.
All right.
Sorry, Wilma. I'll let her go. Everything okay?
Okay, fine. Thank you.
All right, no problem at all. Just wait till you see what this is used for. To be honest, this is the call that, as a country locum, you almost expect to get at any time. It sounds like this mum's in trouble, and I'd say for one of two reasons. Either the calf is huge, or it's coming out the wrong way. And right now, I just hope I get there in time. How are you?
Good, how are things?
Not too bad. I'm Chris.
Yep, Chris, how are you? I'm Mike.
Hey, Mike. How are you?
Wife, Jane.
Jane.
Hey, Jane. How you going? Now, is that her up there?
That's her over there, yes.
Has she been pushing it all? She's been straining a little bit?
Yeah, a little bit, yeah.
She was a bit agitated earlier this morning.
There is so much food around. Everything's so green. The cows are getting fat. When they get fat, the calves are big, and they just seem to lose the ability to really push these massive calves out. Come on, up.
Only last week, Mike and Jane lost a calf during a difficult birthing.
Sometimes if we leave them, we find they just give up pushing.
Yeah, and look, being the big girl she is, to me she looks like she's pretty exhausted there. You can see she's panting up there a bit too.
No, she's had enough. It's time for the carb, I think, and that's what you're looking for.
Forge ahead, I think.
Forge ahead and
see
if we can get him out.
I've got some feet there. I'm just trying to get if they're up or down. What I don't want to feel when I reach inside of her is either back feet or feet that are upside down. If that's what I'm feeling, we've got a massive problem here. I've got the head there. The head's just sitting pretty close to those feet there, so I don't think her positioning is too bad.
That's good. So it's not back to front. So
I think
that's
so.
great.
Fortunately, it's not a breech birth, but the mother is still in trouble.
What I'm going to try and do here is put some chains over the calves' legs. So they go around, essentially around the wrist. And using the chains, it gives you a good anchor point to pull on them. The tricky thing is, it's like trying to grab hold of a spaghetti covered in oil in there at the moment.
Steady, girl.
We're almost there. I'm going to use this. It's a calf jack. You'll see why it's more tricky. It's sort of like putting your car up on a jack, only you're putting a cow up on a jack.
Steady, girl.
The way this is going to work is I'm going to attach these chains to this jack here. And then from there, it's just about applying gentle but sustained force. Okay, see those feet now? So I'm just going to give it some gentle pressure here. And you see it start to edge out. You just can't release this pressure, you do, and the calf just sucks back inside. I know, girl, it's uncomfortable.
At Mike and Jane's farm, Chris is struggling with a difficult calving.
She's just gone down, so the pressure of the calf coming out is just pushing on the nerves in her back, so she can't support her back legs, and that's why she goes down.
The cow weighs 700 kilograms. Chris has no chance now of getting her back on her feet. The risk to both mother and calf has greatly increased.
And we're going to get them out to this position. The sooner they come out, the better. Yep.
Worry about dead calves.
Yeah, they get compressed in there pretty hard.
Just about popped it.
Once you get the head out, then you've got to get the hips out next. Right, there it is. So there he is. It was a bit of a trauma for the calf, but he looks pretty fit.
He does.
Hey? Clean him out. Oh, it's a good result, yes. Absolutely. Very happy to be out in the world. Yeah. Very happy to be out.
And she'll be.
So
thank you. You've done well.
She's not the only one at all.
Not the only one, no. As we often say, the vets only get the hard ones.
That was really tough. I mean, physically, that was very demanding. It was like playing a game of footy. And, you know, when she went down there, that was very stressful because it's not what you want. And the whole time you're thinking about the calf, but you can't forget about mum at the same time because she's as important. Hey, little one. You're giving that a go, are you? Oh, you're close. You're very good. You're very good. Hey, I'm going to call that. They were steps. You did good, girl. It's amazing, just straight away she's over to her calf and the little girl puts on a display for mum, says, look what I can do. Or can't. And these little grunts, they're all just mothering. She's just trying to bond with the calf and basically say, hey, I am your mum. You happy?
I'm very happy. I didn't know whether we're going to have a live calf or not. So.
No, I'm happy too.
I think he'd get a job out here if his other job failed.
No worries.
Okay, thanks for coming.
Lovely to meet you too, Mike.
Great.
Thank you very much.
Jane. Yep. No worries, my pleasure. So I'm relieved to see you doing this. There was a period of time where I thought you actually get no time off at all.
Occasionally we do. There's got to be some perks to living up in this beautiful area.
It's been a challenging week in the bush, but Chris's tour of duty is now over.
It's nice out here. It is. Just need some sand and maybe a few waves, and water needs to be warmer as well.
It's not Bondi, mate.
It's not Bondi. Got to ask though, mate, would you have me back?
Anytime, mate. Anytime, always welcome back.
You mean it?
I do. Well, somebody's got to check the monkey again.
Ziggy. Oh, Ziggy.
Talking of Ziggy, it's good news. The monkey is back home and his tests are all clear.
Really pleased. And the fact that his eyes are much bigger and brighter. It's a bit of plastic surgery works marvels.
Sparkles is recovering well after her run-in with a fence. The family favourite is now taking it easy in her lush paddock. As for the little heifer, she's a picture of health.
I feel a little bit proud of myself when you see a little girl running around and you think that you went through a fair ordeal together. And it just really reinforces to me the fact that the vets out here have to be everything to everyone at any time of day with any type of animal. I've loved every minute of it. I've got a huge amount of respect for the vets out here. But my time's up. It's time to head home. Hey, how you going? Is Pearl, is it? Yeah, no worries.
A panicking Kate has just run into the Bondi clinic with Pearl. The poodle was having a haircut when she suddenly started bleeding into her skin.
They just said quickly get her to the
Okay,
bed.
I can come through now. She's never had anything like this before.
No.
No?
Red welts started appearing on Pearl's underbelly and are now engulfing her whole body.
And what that dark discoloration is where some blood vessels are burst and we're actually getting blood seeping in through the skin there. So it's quite an abnormal reaction. My theory is that the bleeding we're seeing into her skin is just the very start of it. If she's hemorrhaging internally, then within minutes she could bleed out and just die from blood loss.
It's okay, Pearly.
As a vet, you're always taught that when you see those hemorrhages appearing in the skin, think about one condition, DIC, disseminated intravascular coagulation. It's incredibly serious. The whole circulation essentially becomes like jelly. It's like someone throws a handful of jelly crystals in there and the whole blood just starts to set.
Sid. Pearl, enough.
She's never had any...
She's scared.
Yeah.
I know she's scared.
It can kill them in minutes and you have to act quickly. So with Pearl, I'm filling her with fluids and giving her a shock dose of steroids to try to reverse that process.
Do it. Do what has to be done.
Yeah, you might come and put a hand on her because she's trying to come towards you.
Zoe.
At the Bondi Referral Hospital Sash, 1-year-old Zoe is in agony after a 10-metre dive onto a concrete driveway.
How did it happen? Okay, babe.
She jumped off the second floor balcony.
Okay. You saw her jump?
Yeah, I saw her jump.
Oh, goodness, you poor thing.
I love my heart went from here down to here. And I was too scared to look over the balcony, because I thought I'd see her just laying there, but she wasn't there. And I thought, well, she's got up and walked,
Looking at the way it's hanging there, I'm quite worried that she's got a broken leg. Hey, puppy girl, will it make you feel better now?
Lisa is taking Zoe out to the treatment room to give her pain relief and to find out just how bad the fracture is.
Oh,
See that?
that's crunchy. The bone shard is actually punctured through the skin, so it's not the kind of fracture we like to deal with because it means that that bone is exposed to infection and bugs stop fractures from healing. And I guess if we don't treat this aggressively, she could lose that leg.
I know. Sit. Sit, sweetie. Sit. Sit.
Pearl is fighting for her life after she suddenly started bleeding internally.
What really worries me about Pearl right now is that I can't even see a vein to put that drip into. That says to me that her blood pressure has crashed. It's incredibly low. If this has occurred, then perhaps what's going on inside her body is DIC, disseminated intravascular coagulation. If it's DIC, she could have minutes to live. What I'm doing at the moment is I'm putting a lot of fluid through her system right now. So the fluid that I'm pumping in now, you can see how fast it's going in, is really going to help.
Okay, stop.
One of Kate's daughters is ringing for news on Pearl.
You can get it if you want.
No, I'm holding her. They can wait. She's a great dog. She's just one of the family. I have 2 other daughters and she's the 3rd daughter. So I have 3 girls.
Right now, Kate's 4-legged daughter is her top priority.
Michaela, I can't talk to you. Would you go home on the bus with Madeline? Go home on the bus with Madeline. I'll see you at home.
The dose of steroids I'm giving her is incredibly fast acting, but also incredibly powerful. If she does have DIC, then it will act in seconds to hopefully prevent it.
That's a girl. I know.
So when I give this injection here, you may notice her breathing changes a little bit. That's just a sign it's going through her circulation.
At Bondi, a powerful dose of steroids has helped stabilise Pearl.
Here to help you. It's going to be okay.
The poodle started hemorrhaging blood during a grooming session at the dog salon.
What I might do now is just get a blood sample from her.
Pearl's improvement has convinced Chris she's not suffering from the lethal blood disease DIC. But the poodle is still not out of danger.
All right, we're just going to run some tests on that. Okay. It's a really simple test that might give me a clue. And that clue could save Pearl's life. I just want to show you this. So what I've done, I put some of her blood on a slide here.
Yep.
It's now been about 3 minutes since I did it.
Yes.
It should have really formed a thick jelly.
Right.
But
and it's not.
You can see that it's still quite liquid.
Yep.
My feeling is that what's happening inside her body is she's just lost the ability to clot her blood.
Right. Yep, like a haemophilia.
Yeah, exactly right. I would say her problem is that she has a lack of platelets.
Right.
The platelets' role is whenever any little blood vessel is torn, they group together and form a plug and stop that blood vessel from bleeding. This would have been bubbling away in her system for probably a few weeks, but today it's at its worst. And with those clippers going over her, they've caused multiple bleeds, but thankfully, someone noticed. Imagine if she was a black poodle.
Yeah.
They may not have seen it.
Yeah.
In a way, the haircut could have saved her life.
Yeah.
Provided we keep her blood volume up, then if she has a few little bleeds here and there, we can handle that.
Yes.
But if she keeps on bleeding the way she has been, then it's going to get serious pretty quickly.
The blood sample will now be sent to the lab to confirm a lack of platelets is the cause of Pearl's frightening condition.
You'd be a good girl for Mummy.
But right now, Chris's main concern is to keep the distressed poodle as calm as possible.
I don't think sitting still is part of Pearl's go, but for her to really stop any more bleeding, then that's exactly what she has to do. I said rest, don't protest. Okay? Rest, not protest. Yeah?
Good girl. I know, it's sore, isn't it?
Zoe has cheated death after an ill-fated leap from a second-storey balcony.
Ready?
X-rays confirm she has smashed her right leg in 4 places.
Oh, that is a mess.
Incredibly, Zoe has escaped any internal injuries.
It's unbelievable. When I look at these images, the only fractures I can find are in her back feet. The rest of her body seems okay. It's just amazing.
Hello, my darling. Mummy's here, darling. Mummy's here.
It's a complicated surgery. All the bones in that foot are broken and it's going to take a long time to repair that. Poor Gwen is absolutely traumatised by what's happened. I mean, she's in more shock than the cat is.
She's my baby. She's my baby. She really is. Mummy's a gorgeous girl, isn't she?
Later that night at the Bondi Clinic, Kate and her worried daughter Madeline have arrived to visit Pearl.
Can she get up?
That's okay.
Oh, shh. Oh, darling.
What she has on under her skin is pretty dramatic.
It's just so sad. I can't believe this happened to her. Do you think she'll be okay, or?
I guess I just don't know at the moment. The whole idea of keeping her inside is so she can rest.
Love you.
Oh, crying.
After having a poodle myself as a kid, I know that they're intelligent. For Pearl, though, this intelligence is almost her own worst enemy. She's analysing this situation and freaking out as to why she's in here and why everyone is all over her.
Bye, beautiful. Love you so much.
She's taken a dive from a balcony. Super cat.
Why did you do that?
And smashed up her foot.
Did you think you had wings?
At SASH, Andrew Marchevsky is ready to start major reconstructive surgery on Zoe's fractured foot.
It's amazing. She fell from about 10 metres, and doing a few calculations, that means she hit the ground at about 50 k's an hour. All she's done is broken one foot and got a little crack in the other. I mean, it's an awful injury, but it's amazing that's all she's done. Oh, it's crunchy. I'm just going to try and expose the bone ends.
Andrew will now place pins in both ends of the fractured bone to try to anchor the break together.
The problem here is the bones are so fragile. I can't grasp them with any instruments as such because they'll just end up shattering if I'm not very careful. Potentially we'd be looking at an amputation. That's good. I think the foot already looks a little less swollen. That's nice. Couldn't look any better than that. That's really good.
Right, Zoe, you want to go back to bed now? Yeah, back to bed.
In the short term, we're worried about swelling of those toes, and it's important that we allow some give in the bandage so that they do swell, doesn't cut off the circulation, because that can happen like that.
Now it's a top cage, so don't fall out. No jumping.
Let's have a look at you.
Next morning, Pearl's internal bleeding is under control, but Chris is still waiting for her test results to come back.
Chris, got your next appointment here, Mr. Heron. Okay.
A surprise visitor at reception is about to become a welcome distraction.
How you going? How are you? I'm Chris.
Yeah, Ron Heron.
Lovely to meet you, Ron. I thought you had an animal. Sorry. Come on through.
Over the years, there's been many presents from grateful patients.
So you're an artist, are you?
I saw it and I couldn't resist painting.
But today, Chris is about to receive the ultimate compliment.
I'm a bit nervous, Ron. I don't know what to expect here. Ron, that is very, very special. Don't know why Ron's come here first with it, because surely there's still time to enter the Archibald, isn't there?
Thank you.
It's very kind of you.
Could I have a photo taken?
Yeah, of course.
We do. Paintings are better than photographs. They fade and they get thrown away, but you've got a painting for life, haven't you? Smile.
Now I just have to find the right place for it. Got an idea.
All good, but Neil, the clinic manager, has to give the final seal of approval.
Fantastic. Yeah, it's good likeness.
Yeah.
I like it.
What I like about it being in here is that it's understated.
Very understated.
It's very modest.
Very modest, yeah.
The best thing about that picture is the fact that it's Lisa's dog that I'm photographed with, little Lucas. So that means I can give it to Lisa, right? Christmas, birthdays, combined.
Oh, that's really nice what that guy's done. That's
No,
great.
it is actually really nice.
Yeah.
Oh, it's just another day.
It is.
What are you doing? Feel a bit funny.
Let's go see Mum.
Over at Sash, an anxious Gwen is allowed to see her best friend for the first time since Zoe's major surgery.
Yes, okay, puppy girl. Hey, my puppy girl. Hey, puppy girl.
So, hello, Zoe.
Oh, she got so excited when you were
Mummy's here, darling. I've only had it 12 months, but I feel as though I've had it forever. Just walk in the house and it's just so different, you know.
Gwen is 78 years old, and this was a really traumatic experience for her. She keeps reliving that night when she saw her cat just fall off the balcony. I think she's probably suffering from a little bit of post-traumatic stress herself.
She loves her mummy, don't you, darling? She sits on the lounge and we watch TV together. And we watch all the animal shows, don't we? Beautiful girl, soon be home. Soon be home.
Dear Lisa, I just knew you had to have this. So happy birthday. Yes, I'm a bit early.
Maybe it's a huge box of chocolates. Yeah.
It doesn't feel like chocolates.
At Sash, an intriguing parcel has arrived for Lisa.
Oh my lord. It looks exactly like Lucas. It does. It looks better than Chris. Oh no! Look at it. Oh, Lucas looks amazing. Lucas looks unbelievable. Chris is wearing lipstick.
I don't know why Chris has given me this picture. I think, you know, I don't know what he wants me to do with it.
Is that for you to go on your wall at home?
I'm just trying to decide what I'm going to do with that.
Yeah, that'd stop you having babies for a while.
I think so.
That's enough. I think that'll work better until you can take him home, Lisa.
Hello to you. What are you doing?
Back at Bondi, Chris is happy with Pearl's improvement.
So you're pretty up here, aren't you? But, oh, geez. Keep you away from mirrors for a few days, huh?
But her family are still waiting for news about the blood test.
Hello. How you going? All right, so Pearl's doing okay today. Good. What I've done, I ran a whole lot of tests on her body to make sure her kidneys were performing well, her liver was functioning normally. That's all fine.
Yep.
So she's pretty healthy. The one thing she's lacking is platelets. And so what we can do is actually give her steroid tablets. That's going to stop her own body from destroying her own platelets.
Okay.
Okay? If we do that, then she's going to be like any other dog, just with a really bad haircut.
And that costs a lot of money.
So let's try to focus on the healthy dog rather than the dodgy haircut, okay? To now be able to send Pearl home, it means there's many more happy days ahead and hopefully many more better haircuts than she's already had. You know, sometimes, Pearl, in fashion you have to be risky. Taking risks gets results. That's what you've done. I'm sorry, Pearl. Yeah.
Hey, Zoe. Look where we are.
A week after her disastrous balcony dive, Zoe is well enough to return to the scene of the crime.
My goodness.
Hello, Gwen. Look who we've got.
You want to get out? What's
Oh, my goodness.
No jumping, no jumping.
It's such a nice feeling to bring Zoe home to Gwen. I mean, the look on her face when she saw her baby come back home was just priceless.
It feels absolutely wonderful. You've been so wonderful. She is my baby. She is so beautiful.
You wait there, Zoe. There is one thing that's going to change in this household, though, and that is the balcony is out of bounds. Zoe has to stay inside, and I think Gwen's going to stick to that. My goodness, that is a serious drop.
It's a miracle. It's honestly, it's a miracle.
I cannot believe that Zoe fell off this balcony and lived.
Well, you can sit there. That doesn't matter. You can sit there. You can sit anywhere you like, darling, but not on the balcony.
It's 9 p.m. and Chris is responding to an emergency call.
Just come straight through, guys.
Little Lucas has suddenly lost the use of her back legs. Debbie and her son Jonas noticed Luku starting to stumble a couple of hours ago.
All right, she's definitely got some weakness there. You can see she's propping out, just trying to support herself. Yeah, have you got what you pulled off her?
There are 3 different types of ticks that attack animals. The most dangerous is the paralysis tick that injects toxin straight into the bloodstream.
The hallmark of a paralysis tick is the fact they have 2 lighter coloured legs that are shorter, which are the middle pair, and you can see these ones are lighter coloured and they're shorter. So it is a paralysis tick. You can see the size of that crater. That tick's actually been there for quite a while.
Yeah.
See how she's just doing a little bit of a gagging, almost looks like she's trying to vomit? That's just a sign that she's just starting to feel the effects of that toxin, of that tick toxin around her throat.
Tick paralysis works forward from the hind legs to the head. It's now reached Luku's chest, putting her in the danger zone.
Dogs obviously don't pass away from ticks from having weak back legs. It's when their breathing becomes paralysed and they lose the ability to clear their throat, and they can actually be at risk of vomiting and then inhaling it.
The antitoxin is being administered, but it's still a race against time.
If I had to say what my biggest worry with Luku was right now, it'd be aspiration pneumonia. It's the #1 killer of dogs with tick paralysis for a reason. It just shuts down their ability to breathe, and they can't survive that.
Lisa, got one for you.
Oh, God. What's happened?
We tried to jump over a fence to get away from a dog.
Oh, my gosh. Ah, that is a deep, deep wound.
At the Bondi Referral Hospital SASH, 4-year-old Jonty is in serious trouble.
Oh, goodness.
Even emergency vet Lisa Chimes is shocked by the size of the wound.
You can see the underlying muscles there. That's pretty nasty. That's his jugular vein just sticking up there. I mean, this laceration is millimetres away from it. If he lacerated that, he wouldn't be here with us right now.
He bolted down the side of the house to run away from the dog, and either the dog's swiped him, which I don't think so, or he's got himself caught on the fence just jumping over.
Oh, I just saw Martin carrying the cat in and blood everywhere, so it was pretty scary.
Looking through it, it's just black. I mean, it's penetrating right up under his shoulder. I'm surprised it hasn't actually punctured into his chest. He's breathing normally, and that's pretty lucky. Hey, baby, let's just give you this. We don't actually know how much he's bled, but the damage could have already been done.
I'm just looking for any dramatic changes in her breathing or her heart rate.
Back at Bondi, Luku is now struggling to breathe as the paralysis tick poison continues to infiltrate her system.
For Luku, it must be an incredibly weird but also scary feeling to all of a sudden lose control of your body, to not be able to move your back legs and then not be able to breathe, to start to asphyxiate. And that's what she's going through right now.
The antitoxin is now fighting the poison in Luku's system, but it will take several hours before Chris can be sure that it's been successful.
Yeah, she's not gagging, is she?
That's probably a response to the toxin.
Yeah.
If she makes an attempt to vomit and actually doesn't bring it up properly and then takes a big deep breath inwards, then that vomit goes straight into her lungs, and from there she can't breathe through that, and it could be the end of her. Yeah, Luku, can you feel another tick on you? If so, you got to tell us where it is. Otherwise, we've got to spray you. We've got to spray you, don't we? Yeah, that's what I thought.
At the Bondi Clinic, Luku is being given a spray treatment to make sure there's no more paralysis ticks lurking in her fur.
You look a bit rough there, Luku, don't you? Huh?
Chris has just given her the antitoxin, but Luku's back legs are paralysed, and the tick poison is now threatening to shut down her breathing.
Maybe tell her the guy in the blue shirt isn't all bad and she doesn't need to be shaking like that.
I think she knows that already. They suss people out pretty quickly, don't they? She knows you're on her team. She's on Team Luku.
I hope so. Even though I've given Luku that antitoxin, it doesn't mean that everything's going to be okay.
Oh, she's shaky.
They can still get worse for 24 hours after you remove the tick. The antitoxin helps, but it's not a cure straight away.
All right. Okay. I'll leave it with you. Thanks so much. Thank you.
Even though Debbie has left and has said goodnight, I just know she'll go home and she won't sleep. She'll be sitting by the phone waiting, hoping that it doesn't ring, because she knows that if the phone rings, it's not going to be good news. Is that Miss?
It's now 1:30 in the morning. Chris and Erin will take turns keeping an eye on Luku.
I know it's not the most comfortable sleeping position. Yeah, I know. But it helps you breathe. The worry I have is if she has a vomit and we're not watching. If she does, if that goes into her lungs, she pretty much has no chance. I'm not going to be able to sleep if she's like this, so I'll take first watch. How about that?
All right. 2 hours on, 2 hours off. I'll see you in 2 hours.
I'll be here looking at her, and she'll be here looking at me.
All right, lights?
Yeah.
See ya.
Sleep well.
I'll try.
Good kitty, hey? Can't use the other side, it's too close to that wound.
At Sash, Jonty is suffering horrific injuries after trying to escape from the family dog.
I really don't think their family's dog's to blame. This is too clean, it's not bruised enough, it does not look like a dog bite. My initial reaction was shock. I mean, I don't think I was as shocked as his owners were, but that's a pretty gaping wound. We've done some blood tests, and the good thing is that he hasn't actually lost too much blood, so it looked like a lot on the towels, but when we actually ran the blood test, it didn't appear to have affected his system too badly.
You used up one of your lives there, Puss.
Infection's definitely an issue. I mean, that's an open wound. It's been on a dirty surface. Those bugs can get in there and really cause quite a bad infection, so we have to cover him with antibiotics. You are one of the luckiest cats ever. Go get your mum and dad, huh?
It's already well past bedtime for Blake and Abby, but they've been allowed to stay up to say goodnight to their wounded mate.
Can I say goodnight to you?
I think Kirsten did the right thing by encouraging the kids to come out, because otherwise they'd go home to bed with this vision of their cat just gushing blood.
Thank you. It's okay. We'll look after him.
Jonty's whole body just has to recover from the shock, and we need to watch him really, really closely to make sure that he breathes normally right through the night, because if he's got a slow leak in his chest and seems normal now, and then we go and give him an anaesthetic, that could just make things 10 times worse. It's all very scary, isn't it?
Hey, how is she?
Yeah, go have a look for yourself. You'll see.
Next morning, after catching up on some much-needed sleep, Chris is back at the clinic to check up on his tick patient, Luku.
Hello, Luku. You're walking.
The lucky survivor's legs are still wobbly, but definitely working.
Luku's gone loco.
There are, however, some telltale signs of the toxin still attacking her system.
Luku can't go home for another 24 hours, even though she looks so good. It's because her gag reflex, that ability to stop herself from inhaling a food, still isn't strong enough. Still not much of a gag there, is there? Huh? If she was to have a meal right now, there'd be a decent chance that it'd end up in her lungs, and that could kill her.
You know what though? You need to rest. You mightn't think it, but you actually do need to rest. You can't take on the world right now.
Timmy, hey Obi.
Hey, g'day mate.
Hey, Chris.
For Chris's next appointment, he's meeting up with Tim and Obi from the Australian Reptile Park.
Too.
They're on an unusual call out to a nearby emu farm, where one of the natives is in constant pain.
So what do we know about it?
Well, we know it's been an ongoing problem and it flares up, but no one has been able to catch it.
I'm used to getting calls from Tim about all sorts of things. Today, it's an emu with a sore leg.
Dorothy has been limping for weeks, and her owner Jenny is desperate for a solution.
Although she's tame, I can't catch her and hold her foot. So I emailed the boys, because they've helped me before, and just said, what do you think I should do? And they said, do you mind if we bring the Bondi Vet? So I said, oh, that'd be great. It's not supposed to be like that, is it? That swollen bit underneath.
No, I mean, you can see around the base of the leg there, almost her ankle joint. It's so much thicker on that right side. It is bothering her.
To examine Dorothy, Chris will have to contend with her overbearing partner. Turns out frisky Bruce may be the cause of her problem.
Bruce has been at it day and night.
Really? Is that why she's got a sore leg?
Well, I wonder. Never occurred to me. I have to tell children they're dancing.
What sort of dancing do you tell them they're doing?
Or when they say, oh, what are they doing?
Piggyback dancing?
Yeah.
Yeah?
Piggyback dancing.
I've never seen that done. The idea is we remove the jealous partner out of the equation straight away, and hopefully Dorothy be easier to handle.
So why don't you just go in and have a quick go yourself?
Brucey?
He's got no idea he's in trouble.
I mean, it's very hairy. I wouldn't do it myself.
What was that?
You can't run like that.
Hey, buddy. Let's have a look at this wound. It's bled quite a bit.
At Sash, 4-year-old Jonty is ready for surgery to repair a massive gash close to his jugular vein.
Wow. Deep. That's extending right up under his shoulder. All right, let's just flush the bejesus out of it.
Jonty injured himself trying to jump the fence to escape the family dog.
That's nasty. He's really going to be prone to infection with this.
First, Lisa inserts a drain to stop air building up under the shoulder and leaking into Jonty's chest.
Looking in the wound, there's just a lot of space under the skin, and remarkably, he's missed some really major blood vessels and nerves, so he's pretty lucky. It's a bit more involved than expected. It's the last one. I don't know if the dog's going to want to chase you wearing this.
It's okay, mate. Do you want to wake up?
Let's wake him up.
It's all right, buddy.
We'll have a look at the wound in a few days' time, see how it's going, and we're really just going to take it step by step. All right, buddy? It's okay, sweetie pie. Just got to wake up.
Come on, Bruce.
At the emu farm, Chris and Tim are trying to round up the jealous Bruce so they can examine his injured partner, Dorothy.
That's it. Come around. Bit quicker. Bit quicker. He's going to go. Okay, we'll start. Hold up. Yep. Yep. Under. One arm under. That's it. Watch your feet. Got him?
You got him? Yeah. You're a big guy?
I'll get the gate.
Yeah, heavy, mate.
Gate shut. Oh.
That's one way to let him go, Chris.
That's the best look, though.
That was well done, mate.
Now the team need to pin down Dorothy.
Okay, that's it, nice and slow.
Owner Jenny is worried about both her emu and what injuries she might inflict on the boys.
Watch those feet.
That's all right.
Yep. Just grab on there, Chris. One under the butt. That's it. Up. Right, bit of weight on. Whoa, weight on. That's it. Yep.
They're very strong, and when those legs kick, you know, they could really do you some damage.
Just trying to find out where the swelling is. There's just too much fluid here for this to be normal.
Very sore there, so that's when she's struggling each time.
At the emu farm, Chris is finally able to examine Dorothy's injured foot, but she's still stressed.
Just looking for any cuts or puncture wounds that could have meant that some bacteria have got into this joint here.
That was close.
So we've either got arthritis there or we've got an infection.
I reckon we've got 2 minutes, mate.
Yep. I think most likely what it is, given her age, that she's actually strained that joint and brought on a bit of arthritis, and that's why we've got that swelling and why it gets better, then it gets worse again. She just keeps on re-injuring it.
Almost done, girl. Almost done. Almost done.
So the plan is to give her some anti-inflammatories. And also give her some antibiotics just to prevent any bacteria being sucked into that area because of all the inflammation in that joint. Okay, we're good. Well done.
Okay, you want to let it go?
Yep.
1,
2, 3.
Poor darling. It's all right, sweetie. It'll get better. If the injections will, relieve her of the pain, and if it is bacteria and we can get rid of it, it'd be fantastic. I mean, if it's early onset arthritis, then, well, her and me both.
It is pretty important we get that foot right for Dorothy. It's obviously very uncomfortable, but on this farm, she's got someone very special that likes to spend special time with her. Bruce, we've got some good news. Your dancing partner's going to be okay.
Only 1 hour later, the old bird's already starting to show signs of renewed vigour.
Oh, here she is. In fact, she's come to see you, Bruce. You might be in trouble, buddy.
Good job.
Oh, you're a big boy. You're a big cat. You're a beautiful boy. I think we have to get the pink bandage off.
1 day after surgery, and Jonty's shocking wound is healing well.
It's looking really good, Jonty.
Hello. Come in here. I can let him out.
Not only Jonty was in shock, but the whole family was in shock when they came in, so the reunion's going to be lovely. How'd you come?
Hello.
Look who's here. It's a big boy. There you go. So did you find out how it happened?
Yeah, we actually discovered when we got home there was a sheet of glass on the other side of the fence, so I think he's fallen down and clipped the edge of the glass.
Oh my goodness.
At least it wasn't Maverick who did it.
Yeah, it's peace of mind knowing it wasn't the dog.
I cannot believe that Jonty actually fell onto a shard of glass. I mean, he could have cut his throat. He is so lucky to be here with us today.
Bye, guys. Bye, Jonty.
Luku, can you eat safely, huh? You ready? Well, it's gone. There was meant to be some suspense there, but you swallowed it.
At Bondi, tick patient Luku is now eating without any problems.
Lick clean.
And has convinced Chris she's ready to go home.
There you go.
Hello, Luku. Hello, darling. Oh, you're better. Oh, sweetness.
All 4 legs in full working order.
That's the way we like you. You're going to get in one more lick?
No legs? You just want to go, don't you? I thought so. See you, Debbie.
Thanks a lot.
That's all right. No problem. Bye-bye.
I'm sure she'll remember.
That's what they all say. Rejection, it's a hard one to take.
At the Bondi Clinic, bird expert Josh Cook has shattered the peace with a screaming baby. The little sulphur-crested cockatoo was found on a nearby golf course after plummeting 20 metres from his nest.
He wouldn't have lasted, overnight without a fox or a dog or a cat eating him. So, yeah, he was lucky to be found.
There's a very strange sound coming from the waiting room.
Josh has named the noisy cocky Kettle for obvious reasons.
Josh.
G'day, Chris.
How are you?
Yeah, good, mate. So I've got this little cocky who's pretty glad to see you too.
He doesn't look too glad to see me. Look at him.
No.
And you can see pretty clearly compared to the other good leg, that one's hanging pretty limp. You've got to be thinking break. But my fear is there may be more than one break, and there could also be a dislocation in either that knee joint or the ankle joint. Either way, it's a serious injury. You look at Kettle and he's the absolute picture of vulnerability. He's small, he's skinny, he doesn't have any feathers to his name, and he's lost and alone. And he might have a fractured leg. He's in a bad way.
Oh, listen to that heart. It's beating so hard. Yes, it is.
At the Bondi Referral Hospital SASH, Denise from the rescue group Pause has brought in a 1-year-old orphan called Olivia.
Her heart
It's just pounding. It's pounding. If the room was silent, I believe you'd probably hear it. That's how loud it is. I think this little girl's in serious trouble. She could not be rehomed because, you know, she's got this problem. The pound cannot sell her. So death for her, that's it.
Hey, beautiful girl, shall we have a listen to your heart? She's got a really loud murmur. It's okay, Bubby.
Emergency vet Lisa Chimes immediately takes Olivia for an ultrasound to confirm her diagnosis.
We grade these murmurs out of 6, and she's got a murmur that's a grade 6 out of 6, so that's the highest. It's just tragic. A heart murmur means that there's an abnormal blood flow in the heart, and if we don't treat it, that blood volume going in that abnormal direction is going to put an extra strain on her heart muscle, and she will go into heart failure, and she will not survive more than a few months, a year, probably max.
I don't want to imagine anything is going to happen to her, and I'll probably start crying about that, but she's alive and she's going to stay that way. Aren't you? Yes, you are.
The operation to fix this heart murmur will cost at least $3,000.
We ask for donations, and whatever isn't covered, I will cover myself.
Wow.
You deserve to have some more time to live a normal life, don't you? Yes.
He's not known for his silence, Kettle, so it will take a fair bit to subdue this beast.
Chris's cranky patient Kettle needs his leg x-rayed. The squawking chick is lucky to be alive after falling out of his nest.
Oh, he looks so defeated. That's the fracture we're obviously looking for through there. The fortunate thing for Kettle is that he's probably got one of the best bird people in the country on his side, and you know, if anyone's going to nurse him through this, it's Josh. All right.
How'd he go?
Yeah, so he certainly does have a fracture there.
Yep.
It's a longitudinal fracture, so it's not straight across.
Oh, okay.
It's sort of at an angle.
Right.
Across the bone like that.
Yep.
But it is only one fracture. It's been a real blessing. The trick's going to be whether we can actually get this to heal.
Yeah.
The big concern I had from the start was how much nerve damage Kettle had suffered in that foot from that injury. He's still not really clenching his toes. He doesn't really have that perching reflex. That's got to start appearing soon. Otherwise, Kettle really doesn't stand a lot of chance of being released back to the wild. So you lost your mum, flew out of a tree, broke your leg, stuck in the hot sun, and you had to put up with me. It's a rough day, isn't it? It is about to get better, though.
At the Bondi Clinic, Chris must find a way to set Kettle's tiny fractured leg.
This will be very delicate.
Okay.
Incredibly hard to do, these splints. For these sort of procedures, we use some very high-tech equipment.
Okay.
Okay. So they mightn't look like much, but between a set of chopsticks, a paddle pop stick, and a plunger, I can pretty much fix any bird's leg. Just try me. So I think the syringe plunger might actually be the winner.
Okie doke.
So it'll just cushion him if he tries to walk on it. If anyone ever thought they had a bad day, they should look at you tonight, Kettle. Look at you. You're having a terrible one.
Kettle's saviour, bird carer Josh Cook, may just have the answer to silence the pint-sized screamer.
You like that, do you? Still whistling. One more, but look at this. Look at this. You fool. Did it stop the whistling? No. Not even close. Just need to rest a little, buddy. I'm going to be seeing a lot of Josh over the next few days and then over the next few weeks, because these sort of things, they require constant monitoring. There you go.
Okay.
No problem.
See you, Chris.
Thanks, mate. I'll see you soon. If that splint's too tight, it'll cut off the circulation to his toes and that'll really inhibit healing. But if it's too loose, then that bone's going to keep on moving and the bone won't start to mend. Get that? Whew. It's still here.
Hello.
Hi, Lisa. How are you?
I'm good.
This is the
How you-
big day.
How you
Next day at
feeling?
SASH,
Oh, very
Denise
nervous.
brings in Olivia for the procedure, which will hopefully repair her heart.
Everything will be all right. You know, this poor dog has had no luck. It's time that her luck changed. And hopefully it will change now.
Okay.
Cardiologist Dr. Rita Singh will be performing the delicate procedure on Olivia's critical heart murmur. The condition is also known as a PDA, a patent ductus arteriosus.
There's a little bit of tension, nervous energy here today because this is a fairly new procedure at SASH. Traditionally, we've always fixed a PDA by cracking open their chest and tying off that blood vessel. But now we're going to try a newer technique where we don't even do surgery. We just feed like a plug up one of her vessels and plug it off from the inside. Fingers crossed it works.
I've got to do very carefully, so it's taking a little bit of time.
If this new technique fails, surgeon Andrew Marchevsky is on standby to perform traditional open heart surgery.
The problem with her is she's a really little dog with a really big abnormal vessel. And because of that, we can only get quite a small plug up her artery into her heart. And the plug size that we can get up there may not be big enough to actually plug the hole. And if that's the case, then it's back to me.
Here we come. So it's coming now. See, it pulled through. Yeah, it's too small for it. I'm just going to try once more, but I think this is going to be just too small.
Rita has to be really careful here because if there's one wrong move, it could tear through her vessel and she could bleed out. So it's pretty risky, pretty fiddly, and there's a lot of pressure on here.
It takes way longer than I expect it's going to.
Cardiologist Dr. Rita Singh is struggling to block the faulty vessel in Olivia's heart.
Well, I'm going to try to push the plug in now, but as I said, I think it's not going to work.
Despite Rita's doubts, the plug is finally in place.
Yes. We're going to keep our fingers crossed the next 24 hours now and we'll see.
I'm getting a little bit excited now.
Finally, I'm going to let you get excited.
Yay, Rita!
Just when the team is starting to celebrate,
Let's put you to bed.
suddenly Rita notices a change in Olivia.
I think it's moved.
Really?
I can hear a continuous murmur now.
Their joy has turned to devastation.
Poor dog. Oh.
We're just in complete shock here. I mean, everything was looking so good and Olivia was recovering, and then in a second she moved too much and the murmur's back. The device didn't work. It's really disappointing.
That's it. It has to be surgery now. I thought we were done. I knew she was going to be fine.
So she's just over here, having a little rest.
Hello.
After the anaesthetic.
Later that afternoon, a shattered Denise is allowed in for a quick visit.
Can I pick her up?
Yeah, you can pick her up.
Very, very distressed. Really distressed. Yeah. Didn't want to open her chest if we didn't have to. We took the easy option, but it didn't work. So now we go for the hard option. So you've got one more chance. One more chance, hey?
Hello. How are you? G'day, Sophie. How you going?
Hey, mate.
Hey, Ron. Hey, Sophie. How are you? This is Farley, isn't it?
It is Farley.
Hello, Farley. How are you? You good? Speak. Good.
Meanwhile, Chris is keeping a special date at the Children's Hospital in Sydney's West. He's made a promise to help one of Australia's most inspirational little girls, Sophie Delizio.
Do you want me to get it out?
Sophie has just the most incredible story. I'm sure everyone's heard about it. A car crashed into her childcare centre and caused her to have third-degree burns to 80% of her body. She lost both of her feet, but the staff here at Westmead, they saved her life.
Okay, and this is its kennel. Put the dog.
Now, Sophie has her own Day of Difference Foundation to help other critically injured children.
Is this Jack?
This is Jack, yeah.
Today, she and Chris are handing out Tara dolls, named after Sophie's first assistance dog.
My dad thought that it would be a good idea to call the dog Tara as a remembrance of my dog. She was a good help to me and I really do miss her.
From the same litter, I reckon.
Sadly, Tara passed away 2 years ago. Sophie's now waiting to get another four-legged helper.
Drop, roll over. It's a high 16. I never cease to be amazed at the impact that pets can have on kids, and when they find themselves in horrific situations where they're going through a lot of trauma, a lot of pain, an animal just can soften that whole experience. And that's why I'm so behind pet therapy, because it does work. It really does make a difference. Can I do one more?
Yes.
Sally, speak.
I was so mad. It does help blocking your ears. Makes me feel really happy that they have something to enjoy while they're in hospital. So.
No worries at all. It's our pleasure. And look in their faces. They forget about everything else and just see this little puppy dog in front of them, and that's what it's all about. You know, just for those few seconds, nothing else matters.
Hello, puppy.
No pressure today.
No.
None.
Last chance in, huh?
2 days later, Olivia is back at Sash for her second heart operation.
The buck stops with you?
Yep. This is the last chance for her. It's either going to work or she'll die, you know. This is a really big heart, and this is this abnormal vessel, so we're just going to dissect around this and tie it off, and then immediately everything will start going in the right direction. It doesn't take much dissection in slightly the wrong plane to dissect through the heart. If that happens, it's all over. It's delicate. The vessel that we're dissecting around is so thin-walled, and if I push it at all, I'll just push straight through the vessel. And then it's all over.
At Sash, the open heart surgery on rescue dog Olivia has reached the critical stage. The pressure on surgeon Andrew Marchevsky is palpable.
Right, I'm just tying it off now. All right. Goosebump movement. Yeah. She's fixed. It's pretty exciting, huh?
I knew you could do it, hero Andrew.
Thanks, Lee.
You're amazing. You're my hero. As composed as Andrew was, you can even see it in his face. He has really breathed a sigh of relief that this is over.
She's going to take a few days to become good, but well, I think Olivia will find a home now because she should be just a normal, trouble-free dog.
Good to see you, buddy.
Yeah, likewise. Come on through.
Thank you.
It's a big welcome for Chris at Josh's bird menagerie.
Here he is.
Kettle, the screaming cockatoo, is ready for his final checkup.
Look at you. That's fully dressed now. Our little boy's grown up.
This is how Kettle looked when Josh first brought him into the clinic after the baby broke his leg. What a difference 2 months has made.
You take the cast off. Look at that. Nice and straight.
moment of truth.
Oh,
Nice work.
oh shake it off.
In a few more months, the lucky cocky should be ready for release.
Where's the whistle go? Yeah, you're a bit proud of yourself, aren't you?
Who's this? Oh, look, here's your new mum and dad. There you go.
As for Olivia, she's made a full recovery. Her foster mum Denise has found the orphan a permanent home with Terry and Spen.
Oh, I miss her heaps. I will. She's such a lovely little dog. But she's ready to go.
We couldn't have wished for anything better.
Isn't that lovely? She's perfect, isn't she?
She's gorgeous.
And she loves you.
It is emotional.
She's going to be the sunshine in our life.
Down the road. Yeah, so the back leg is looking dodgy.
All right, you better come straight through.
At the Bondi Clinic, Chris is confronted with a shocking hit-run emergency.
What's her name?
Bluebell.
Bluebell. Oh, no, Bluebell.
That's Bluebell. Yeah, she's a doctor from here. Yeah, that's right.
Aww.
Bluebell is just 2 years old and a regular patient at the clinic.
What happened?
Well, just basically someone knocked on the door and said that they found her on the road, and did I know who she was? And yeah, she's my neighbour's cat.
She's got some cuts inside her mouth and obviously some pretty deep bruising around the side of her gums there.
We found the last cat that they had, and that had been killed on the road. So, yeah, I don't know why. It's outside our house.
Okay, I just get a little bit worried when you see them panting like that. There's every chance she may have actually got some sort of trauma to her chest as well, and that may explain why she's having trouble breathing. What I'm trying to do is just trying to stabilise her and just stop that panting. Because if she can just get more oxygen around her body, then we buy ourselves so much more time.
And now has to break the terrible news to Bluebell's family.
She's been hit by a car. No, she's not dead. Okay.
You got permission to bite me if I do anything that hurts, because hurt right now mightn't be a bad thing. Okay?
Chris urgently needs to stabilise Bluebell, but his major concern is the lack of movement in the cat's back legs.
His back legs just don't have a lot of muscle tone to them. She doesn't seem to have too much awareness of where those back legs are or what they're doing. Was she meowing a lot? Did she seem in pain?
No, she was absolutely fine.
The fact she's not showing a lot of pain, it worries me more than if she was squealing out right now. Potentially she may not have those messages going through, and if that's the case, then you worry that the spinal cord might have some damage.
Sore, mate?
At Sash, 4-month-old trainee police puppy Ken is in agony.
I knew something was wrong because I'm on night work at the moment and he didn't bother me, he didn't wake me up. Went out to see why he was so quiet and I noticed a large lump on the side of his jaw.
This is probably as close to a police dog's mouth as I'll ever get.
He may only be a baby, but emergency vet Lisa Chimes is treating Ken with a healthy respect.
Okay, that is really swollen. It's like a golf ball.
It came up very, very quickly, within 6 hours. And he's really lethargic and just not himself because he's 100 miles an hour, he never stops.
Not a great sign. So let's just check you out.
I'm a puppy tragic, I am. Yeah, I've been in the dog unit for nearly 25 years and in that period of time I probably would have had over 100 pups at home. You get very attached to them and it breaks your heart when you see things like that. Yeah.
So he has got a fever. His temperature's 39.7, so upper normal for him I'd say would be 39 max.
Yeah.
So that would explain why he's really not feeling very well at all.
Yeah.
So basically, I think what we need to do is admit him to hospital. I'm not going to know much until I actually
can get a good feel, and he's so sore there,
Yeah.
he's not going to let me do it without sedation.
That's fine. Now, you be a good boy now. I know, you be a good boy. Poor bugger.
Ken is really sore, and I'm worried he could have a nasty abscess, and that could turn septic and poison his bloodstream. But what could be even worse is that he's got a fractured jaw, and that would really put his police career on hold.
Has she flicked that tail at all?
No, she hasn't.
Hit-run victim Bluebell is in a critical condition. Chris's major fear is spinal cord damage.
The tail is controlled by all the nerves that are running to and from the spinal cord. So the movement of the tail is a pretty good indication of how that spinal cord is functioning. And at the moment, that tail of hers hasn't moved an inch.
Bluebell is no stranger to the Bondi staff. 2 years ago, she was one of 4 stray kittens dumped on the clinic doorstep.
I looked after them when they came in as kittens. And I've looked after her ever since she's come in, every time she's come into board.
It's one of those things, when you know so much about a patient like we do with little Bluebell, it's worrying.
Bluebell's distraught owner Grania has just arrived with her children Rory and Amelia.
Hi, how are you?
I'm all right, thanks.
So, Bluebell, she's obviously been hit by a car. She's stable. She's breathing relatively comfortably at the moment. What I want to do now is take some x-rays. I just want to make sure that everything in terms of her spine, her pelvis, everything that's important in that respect, I just want to make sure that that's okay.
Do what you can for her.
Yeah, no, she's a sweet cat, don't worry. Everyone
She's
here.
gorgeous, and they know we're here because that's where we got her from.
Yeah. This x-ray is going to tell us a lot. The spine is what it's all about at the moment. We can fix a fractured pelvis, but a spine, it's going to be tough. I don't like this. I don't like this.
Can you come up on the table?
At Sash, trainee cop Ken has shocking swelling
Let's
on
get
his
some
jaw.
blood. Poor little Ken is absolutely terrified, let alone painful. I mean, this morning he woke up and he was fine, and then just over the last 6 hours, this massive swelling has blown up, and now he's feeling awful. It's terrifying for him. That's really hard. At the moment when I'm feeling it, I'm thinking it's an abscess. It's hot and it's hard and it's painful. Oh, my love. Okay. Oh, baby. All right, Bubsy. Have a nice rest. The next thing for Ken is for him to have a general anaesthetic. When you wake up, it will all be over. Allow me to have a really good feel of the area. I'm going to take some x-rays just to make sure that he actually hasn't got a broken jaw. So this is the swelling on the left side of his jaw. The good thing is his bones actually look normal, and it does appear that it's just affecting the soft tissues surrounding the bone. So I'm just going to shave the area, and then we're going to stick a needle in and see what we get out. But if it comes out with pus, then it's an abscess, and the only way to fix that is to open it up with the scalpel blade. Now, that's not the normal yellow colour you would expect with pus, say, in a pimple, but that's pretty chunky, and I'm happy that that is fluid from an abscess. If we don't open up that abscess, that infection is just going to brew, the swelling's going to get bigger and bigger, and Ken will just get really sick.
She's got a pretty serious spinal injury there. That isn't a fracture. It looks like where you've got one vertebrae and you've got another one, the force of the impact's just pushed one up.
At the Bondi Clinic, X-rays have confirmed Chris's worst fears about hit-run victim Bluebell.
That's the canal the spinal cord sitting inside. Now, I can't see how it can go there and then bend and come up here. That spinal cord doesn't bend. So how it is actually going there and then to there, I don't know. There's moments when Bluebell comes in and you're fighting to keep her alive. You have a little win in terms of stabilising her, and then you get that x-ray and it just like a big punch to the chest. She just sucks the air out of you because you know what it means.
At Bondi, Bluebell's family are waiting for Chris to tell them the result of the x-rays.
She's a very loving, gentle cat. She's chased every day by our dogs. We've got too many schnauzers and she just doesn't mind. She lies on the kids' beds and they, you know, jump on top of her and she just doesn't mind. She's beautiful.
I'm just going to call up Sash because we need to organise an operation for her pretty quickly.
All Animal Specialist Hospital, Michelle speaking.
Chris is now calling surgeon Dr. Andrew Marchevsky for advice.
Just had a cat brought in that was hit by a car, and at L3, L4, there's a disarticulation, so a bit of a step.
When you pinch your toe, does she complain about it?
She doesn't look happy.
But she's not demonstrably going, ow, that hurts when you pinch your toe.
No.
That's a very bad sign.
Yeah.
Yeah. If they've got no deep pain perception, then her chance of recovery with surgery is less than 5%.
Okay.
Okay.
Not good. It's not good news. I'll speak to the owner. Sorry that took so long. I just took quite a few x-rays to know for sure exactly what was happening there. So they're looking at about a 5% chance with surgery of getting it right.
Okay.
So it's not the news we want.
No, it's not. And it's not. Of course, I'd like you to do everything for her, but I also don't want her to be in any huge distress. Can we go and see her?
Yeah, absolutely.
Yeah.
Hello, darling. Hello. It's all right, Bluebell. Do you want me to give her a pat? That's it. I think I know deep down what we should do.
This is such a heartbreaking decision for Grania to have to make. It's all about little Bluebell's quality of life, and they love this cat so much, yet if she can't walk around by herself, let alone do cat things like keeping herself clean or go to the toilet even, it's no life. And so I totally understand the decision.
We're not coming home today.
I don't think she's coming home, no.
They don't understand, they don't try to work it out, but there's just this innocence there that everything will work out all right. And in this situation, it doesn't.
Your emotions go all over the place. It's not only the family that suffers, it's the staff around here, everybody that's cared for this cat, they know her so well.
Everyone's beaten up by her. She was a part of this place for a long time.
You right? Now that I know that Ken's got an abscess and that thing is filled with pus, the only way to treat it is to actually make an incision in it with a scalpel blade and drain it.
4-month-old police puppy Ken is undergoing surgery to remove a massive abscess from his jaw.
What I'm doing now is I'm putting in a drain, which is basically going to keep the abscess open, allow us to clean it, allow that bacteria to drain out, because as soon as that skin closes over, the infection will start up again.
Ken's drain will remain in place for 3 days.
Now we're going to put him on a course of antibiotics and anti-inflammatories and hope that that heals up. Now you have a good night's sleep. Now you're going to feel so much better. It's not looking like a tough police dog right now. It's just a big baby. Only 4 months old. I think everyone forgets that when you look how big he is. He is just a little boy. And then in 1 year's time, you probably won't be doing any more cuddles like this. Be chasing those baddies. Just a baby.
Ken, hello, gorgeous.
Look at you. Oh my goodness. This is a puppy.
Just one day after having an agonising abscess removed from his jaw, apprentice cop Ken is back to his playful best.
Watch out. Watch out, criminals. You cannot compare Ken from yesterday to today. He is a handful. I can barely control him and he is just behaving like a normal pup. All right, this is about as close as I'm gonna get. The jaw looks a lot better as well. The swelling doesn't look as angry and it's definitely less painful to touch. So I think he's on the road to recovery. Now you look like a cop. Look at you.
Hey, Jeanette.
Hi, Chris.
What's going on?
Here we are again.
Hello, little man.
At Bondi, a blast from the past has arrived unexpectedly at the clinic.
Come on through.
Okay, thanks.
I walk out and I see Jeanette. I know her. But there's this dog with her. Is it Robert? Last time I saw Robert, he was this big and covered in mucus. You've been a bit nosy, were you?
It's been 2 years since Chris helped Robert into the world. Today, the little terrier's in trouble after taking on a couple of aggressive Afghan hounds.
That's not his whole pad, is it?
No, it's just the end of the band-aid. When I say that Robert's been taking on Afghan hounds, which are 10 times his size, he was taking them on through a gap in a garage door this wide. Brave? I don't know. I doubt it. The nail has actually been lost. So he's ripped out his toenail.
Ooh.
Yeah, which would be really sore.
Yeah.
So it's a broken toenail. It's incredibly painful, but the reality is it's not going to kill him. And let's face it, the toughest moment of Robert's life came right at the beginning. Give me a push, girl. Mum Bindi was in labour for 10 hours, from 8 p.m. through to 6 a.m. That was an intense night. For me, probably one of the hardest nights of my whole veterinary life. Scream like you hate it. Come on. Despite all sorts of complications, we ended up with 2 healthy puppies, Robert and his sister Juliet.
Oh my gosh, what a night. What a night.
Sure, you have your gut-wrenchingly sad days like yesterday with Bluebell, but as Bindi, Robert and Juliet showed me, you have your really uplifting ones as well. Are you shaking because of what's happened today or shaking because of the last time I saw you, we might have kissed? Do you know that?
The kiss of life.
After a quick treatment of that injured foot, Chris's unofficial godson is ready to take on the world again.
You think he's limping? He's not limping. What he's doing right now is just showing what he's going to do next time. Big left hook. You hit him, mate. Don't hit him. He's a big, strong dog with attitude. Too much attitude.
Hello, Lisa.
Is this Ken?
Yeah, it's little Kenny.
That's a
Medium-sized Kenny now.
3 months later, Lisa is summoned by the boys in blue to check up on police trainee Ken and his surrogate dad, Tony.
I was a little bit concerned that having an abscess on his jaw was going to slow down his training, but he's passed the first stage.
That's a good dog.
You can see there's a look in his eye and a strength in that jaw that he is going to be a serious police dog one day. Do you want me to hold on to
If you don't mind. He's wanting to come with me. Woohoo!
I got rope burn.
Gut feeling is he'll be like his father, an absolute terror on the streets. All I can say is look out, criminals.
Oh, Chris, Tim Faulkner is on line 1 for you.
Okay, no worries.
On the line at the Bondi Clinic is the operations manager from the Australian Reptile Park, Tim Faulkner.
Hey, Timmy.
Hey, how you going, mate?
Good, buddy. What's going on?
Well, I'd like to see if you want to take a quick trip up to Cairns. Bit of a once-in-a-lifetime opportunity.
We're not going snorkeling, are we? I just know that.
Open your computer and have a look at what I've just sent through. You are going to love this one, mate.
Yeah.
It's a 7-metre female scrub python and they call her Big Mama. She's living in the roof of an outrigger canoe club and she's terrorising all the women that paddle there.
What is that?
Tim has sent Chris a video of 2 huge male snakes captured on a mobile phone inside the club rooms.
Mate, they're huge.
The males are there to mate with Big Mama.
We need to go ASAP. It's breeding season now. She's been spotted there recently. This is our chance.
Oh, righto. Righto. We're going.
While Tim and Chris are heading to the tropics, Sash emergency vet Lisa Chimes is in Sydney's west at an animal shelter.
Who's the happiest ones? They adopt out something like 5,000 dogs and cats a year, and I love them for that. I got the worm tablets. Wait. Good ones.
But Lisa's vet checks are interrupted by the unexpected arrival of 6 homeless Shar-Pei puppies.
They are so cute. When I'm playing with these puppies, they are so adorable that I just want to melt. And thinking to myself, why would anyone dump such gorgeous babies? And when I look closely at them, I can see why. And look at that. Oh, darling. This little puppy's basically blind. I mean, her eyelids just won't open because they're rolled inwards. It's pretty awful. So the condition is called entropion, and basically their eyelids are growing inwards. So their eyelashes are rubbing up against the surface of the eye, and it can cause major irritation. It can potentially cause blindness.
Surgery is the only answer. Without it, Lisa knows the little ones have no chance of finding a home. She needs to call in a big favour.
And I was wondering if it would be possible if maybe you could come and help us out.
How excited you are.
This could be the biggest scrub ever.
Yeah, well, that's why your pole's that big and mine's this big. You could have told me that.
That's for the tail.
I'm not ready for this fight.
Chris and Tim have landed at Cairns Airport. They're now on their way to Yorkeys Knob to try to capture a monster female scrub python living in the roof of the local boat club.
You had much to do with scrub pythons?
Oh, I've had enough to do to know that they scare me. And the teeth.
Yeah.
Huge.
That's the thing, isn't it?
They eat full-grown wallabies. Swallow them whole.
Known to locals as Big Mama, the legendary reptile is scaring the hell out of the lady paddlers.
Scrub pythons are a bit mythical, like crocodiles.
Yeah.
Who's seen the biggest one?
Yeah.
And this could be big.
The boys are on a tight schedule. They only have 2 days to complete their daring mission. All previous attempts to remove Big Mama have failed.
In the dark, in a confined space, with a snake that's 6 to 7 metres long. Awesome. Hey, how are you?
How you going?
How you going? I'm Chris.
At the Yorkeys Knob Boat Club, Chris and Tim are met by the CEO, Stu, and one of the outrigger canoe paddlers, Sue.
This is where the action's happening?
Apparently.
Well, do we bring the right gear or what?
Oh, mate, you might need a bigger hook than that.
We would hate to see something happen to her, and that's the priority, is to make sure she's protected.
You've seen her across here?
We've seen her the width of the road.
Like she goes right across?
Right across. It was
It's time to lift that denial and acknowledge the fact this is a very big snake.
1, 2.
She's a monster.
3, 4.
And I'm in trouble. 5, oh dear, 6. Right across.
Right across.
Tim, he's in trouble as well. He doesn't know that yet. Look at his face.
You know, off the camera, all day, I've been really psyched up. You guys take all the time in the world, and now I'm getting really psyched out about this monstrous snake. There's a little bit of poo in my undies.
Snake in the roof right now.
Now.
Check it out.
Whereabouts? Through the back there?
Yeah.
Inside the club rooms, Chris and Tim get their first look at one of those male visitors.
Oh, man, he's a little one.
Serious?
Yeah,
That's a baby.
That's an absolute baby.
He's still a handful to grab.
The size of his head was like that.
Yeah.
He's a toy.
Oh, jeez.
This is where she has her, shall we say, late night meetings.
Look at
This?
that.
She does this with her men.
She does this. Shall we say she's a popular female? She's maybe a socialite, a Paris Hilton of the snake world.
I'm going to go up there, and I'm starting to think the hook's no good because there's no way to work it into the roof, so it looks like I'm going barehanded. Yeah.
Yeah. The reality is, because she's got so big, she's become a danger to to the dogs, the cats, and really the kids. The really awful thing is that you put your head up through one of these holes and you're looking around and you think, I haven't checked behind me. You look around and there could be a snake right there, just waiting to grab you. It's an awful feeling.
Chris and Tim are on a mercy mission to Cairns to try to remove a frightening 7-metre python from a local canoe club.
This is like a posh hotel here. You've got all these lights, you've got hot water systems. The snakes are just sitting on top of them. They duck outside, they go to the supermarket, eat a fruit bat, come back in, digest the food, lay your eggs, hatch your babies. It's just the perfect area for big snakes. There's snake skin everywhere.
Local folklore around here says that Big Mama is 7 metres long. If she really is 7 metres long, she's the biggest scrub python ever recorded. Oh, Timmy.
What do you got? Snake?
Snake skin.
Skin.
I don't know. I don't know how big it is. Grab all of that.
Oh, it's big enough.
Oh, gee.
I have had a bit of enough. It does put you on edge. I mean, everyone talks about the beauty of it and all those things. I'm over the beauty, just get the snake out. Okay, just want to go out, train without peeing your pants would be great.
There's some big snake.
Oh, Timmy?
Yep.
Yeah.
You got one?
Yeah.
Watch him. They'll bite, mate.
Yeah, I know. Everyone that knows a little bit about snakes always says, oh, pythons, you shouldn't worry about them, not venomous. With scrub pythons, it's different. They've got massive teeth, and when they latch on, because the teeth face backwards, you can't get their head off. They call them the pit bulls of the snake world for a reason. I got him. He's not a big one.
Jeez, look at that. How beautiful is that?
Good to say, Timmy, it's 1-0.
No, that's a half.
Mate, this
at
is
best.
Is this a scrub python? Yes, it is. Did I catch it? Yes, I did.
It's a baby scrub
1-0,
python.
Timmy. 1-0.
The funny thing is that Chris is all cocky now. I've got a snake, mate. Wait until he sees a big one. He's going to freak.
I've got a really big favour to ask you.
At the Animal Welfare League shelter, Lisa is sending out an SOS to Sash Eye specialist Mark Bilson to help her save the abandoned puppies.
And I was wondering if it would be possible if maybe you could come and help us out and have a look at their eyes with your equipment. Okay, see you soon. Bye. Yeah, he's coming.
All right, that's awesome.
It appears the babies have been dumped because they're all suffering from a serious eye disease called entropion.
It's one of the things that make them so cute is all the rolls on their face, but when they're bred incorrectly, those rolls can be so severe that it can cause permanent eye damage and blindness.
It's just a toy. This toy. What's this?
This shelter survives on donations. The voluntary services of the SASH team will now make it possible for the puppies to have their crucial operations. Without surgery, they have no future.
It's a horrible thought. I mean, these guys have got a long life ahead of them and a family somewhere that would love to have them. So it's a really sad thought to think that they may have been euthanized somewhere else, but our concern is we want to make sure that we're rehoming happy and healthy dogs, and they definitely need the surgery, without a doubt, and the sooner the better.
Hey, bring that back. Excuse me.
More skin.
In Cairns, Chris and Tim are continuing their search for the legendary Big Mama and her harem of boyfriends.
These snakes are so strong. They can constrict and have the muscle power to eat a wallaby and, to strangle us.
I reckon I can see something.
A snake?
Yeah. Go up that end. It's a monster.
He should just come past me and I can grab him.
Yeah.
What's going through my head up there is I'm about to grab the snake and I can see its head is don't bite me, don't strangle me. They're the two most important things.
Just be careful because it's facing that way.
Okay.
He's moving now.
Okay, again. Yep. He's just past me. Yep.
You got it?
I've got the head, yep.
Shocking.
They are shocking, eh? Yeah, it's right up there.
At the Animal Welfare League shelter, SASH Eye specialist Mark Bilson has responded to Lisa's SOS and donated his time to help the dumped puppies.
It's really swollen in there and you can hardly see any eye. There certainly is a chance there's going to be some permanent damage. This is one of the worst that I've seen for a while.
Mark wants to operate immediately.
Well, what we can do is effectively a bit of an eyebrow lift where we're going to put some stitches in and get their eyelids out of their eyes.
How could anyone give you up, huh? Without even giving you a chance.
Yep, it's just past me. Yep.
You got it?
I've got the head, yep. Got it, mate.
You got it?
Yep.
This?
Yep, just take it down. More.
Keep on going in here.
Hold on, he's dead. He's dead. Feed that down.
As the battle heats up, what the boys don't know is whether the snake is Big Mama or one of her boyfriends.
Pull this way.
Yep. Keep coming.
It's hanging on at this end. Which way do you want me to pull?
Grab this here. It just kept coming and coming and coming. Big snake.
Oh, jeez.
Over.
Oh, wow. Oh, my God.
Look at that.
It could be her. It could be her, you all right?
Yep.
There's obviously a real buzz about trying to find Big Mama. But in all seriousness, the most important thing is getting her and moving her somewhere safely, because she's a once-in-a-lifetime snake. Oh, mate, let's get her on the lawn. She's a monster. Stretch her right out there, Timmy.
There you go. What are you at?
4.9 metres.
4.9.
It's not her, fellas, I don't think.
You don't reckon it's her?
I don't reckon it's her. I reckon it's a bit small.
I was shattered when he said it wasn't Big Mama.
They were pretty excited about it. I didn't want to tell them it was definitely not her.
Oh, mate, flip him over. There you go.
Oh. You're right.
We've had a few of them.
You are right.
There you go.
There's little spurs here. He's come out of Big Mama's house, but it ain't Big Mama.
Oh, man. Head down. 1 second. 1, 2, 3.
They've still got a lot of work to go and a lot of crawling around in roof spaces and looking to find her.
That's it.
Oh, baby. Get rid of those wrinkles like that.
Eye surgery on the homeless Shar-Pei pups is about to begin. Lisa and Mark know the future of these brothers and sisters depends on these operations being successful.
Look at this, Lisa. This is nasty. You see that down there? So it's quite damaged. That cornea is much cloudier than it should be.
That is just shocking.
If that had been left, the scarring's going to get worse and potentially interfere with her vision more severely. Not bad.
So need another one then. These guys are not in pain anymore because we've opened up those lids that were rolled in and those eyelashes are no longer scratching on the surface of their eye.
Slowly, the patients start waking from their anaesthetics.
Really glad I came. It's nice to see them with their eyes open and they're very cute and looking forward to hearing about their new homes.
How about a big group hug for everybody?
Stinks of snake up here.
Next day in Cairns, a nervous Chris and Tim have decided to climb right into Big Mama's lair in a last-ditch attempt to find the monster python.
Oh, it's just hot in here, just oppressively hot, 35, 40 degrees, and it's perfect for snakes, but geez, it's not good for people. Oh, man. Oh, it just don't fit.
The boys are running out of time. Both have commitments back in Sydney and need to return home tonight.
Basically, we've demolished the place. We haven't found the snake. I don't think she's in there.
Enough of all of this lies. Mamby-pamby, warm fuzzy stuff, just get the snake.
Thank you. I'm taking it on board. Is this all just one big wind-up?
No!
The girls wanted to see you.
Yeah, that's right. Surprise!
Thank you, mate.
Tim, thank you.
Yeah, no worries.
Just be kind when you tell stories about what we did here, all right?
Always, always. I'm not surprised they didn't get her. Many have tried, many have failed.
See you, Big Mama. Yeah, you won. convincingly.
As for Lisa's patients, the puppies are recovering well from their eye surgery, and all have found new homes through Sharpay Rescue.
Hello.
Hello.
I recognise those eyelashes. Hello, gorgeous. You must be Jo.
Yes, and this is Lily.
Oh, Lily. Hey, Jack, do you love Lily? Ooh, yeah. It's one thing that we did the surgery to help them see again, but now that I know that Lily has a loving family, it just warms my heart.
Thank you so much.
And good luck. See you later.
Take care. Bye.
Someone's very upset.
Love, she has to go.
Oh, I'm sorry, Jack.
Yes.
I'll see you soon, Jack. My patients never get upset to say goodbye to me, but Jack and I were best buddies. Love at first sight. It was pretty heartbreaking that he was so upset when I was leaving. Aw, it's nice that someone loves me. Aww.
It's no boat club, but it's all right. Came in for a nice surprise.
There's one last thing for Chris and Tim to do. Release their snakes back into the wild.
See you later.
Look at that.
All right, it's a bit of a difference there.
You can smell his home, a bit more lively. It's satisfying to see that snake just take off here into the jungle. Now, away from suburbia, into the jungle. It is perfect.
You know what? We didn't get Big Mama, but in a way, what that allows is for this legend to live on. And that's kind of nice. See you, buddy.
Thank you.
Good job, Pete. Well done.
At the Bondi Clinic, Jules and her sons Tenzin and Ty are very worried about their pet chook Daisy.
We're thinking that she's actually got a broken wing or dislocated. I'm not sure, as we don't know much about birds.
Hey Chris, I've got your next appointment here now.
What is it?
I'll do an impression for you if you like.
Dog in convulsions.
Chicken.
In here we get all sorts of animals. Dogs, cats, guinea pigs, rabbits, snakes. We don't get too many chickens. Chickens aren't your typical Bondi pet.
She had a bit of an altercation with a 3-year-old that lives up the road. He broke out of his house and came down and thought maybe he'd take her for a walk or something. And I guess there was a bit of a fight between them both, because I think he got a few scratches as well.
Oh, really? Yeah. I just want to feel my way along there and just see if I can feel any breaks. Just trying to keep it cool. Very nice. A bit more, thank you. The really encouraging thing for me right now is the fact she is actually willing to use those wings. She's really flapping them around. So what I'd be suspicious of is that perhaps her shoulders are working fine, but if she has a problem, it may be lower down in the wing.
Yeah.
Any fracture in a bird's wing is always quite serious.
Yeah.
Because those wings move around a lot, so it's hard to actually stabilise a fracture. So I guess just prepare yourself that it might be difficult to fix this.
Okay, she's got a very high temperature. Her body temperature is 40. Okay, so the normal is, and there's the blood.
8-year-old Safi has been brought into the Bondi Referral Hospital SASH after losing a huge amount of blood.
And she's blind, you said?
She went totally blind last year.
Susie is babysitting Safi while her owner is overseas. She's been like a surrogate mum to the little Shih Tzu since she was a pup.
I know her mum devastated. It won't surprise me if she just gets the next plane back. I don't know what she'll do.
That's some serious bleeding from her rectum. All right, we just need to do a blood count and make sure how anemic she is. Check if she needs a transfusion. All right, baby. Good girl. There are a few conditions which could be causing Safi to bleed from her bowel. Now, one possibility is ulcers, another is inflammatory bowel disease or an infection.
Those are all treatable. Another cause is cancer, and that would be the worst possible diagnosis.
Now, Daze, what I normally do here is hypnotise you so you lie still and hold your wings out like that.
Chris is trying to find out what damage has been caused to Daisy's wing after the chicken had a run-in with her 3-year-old neighbour.
Getting good at this. X-ray.
Fortunately, the X-ray shows Daisy's wing is not broken, just sprained.
That's normally a pretty strong joint, so for her to actually sprain that takes a fair bit of force. And the only force I can really think of is her wrenching herself out of the grips of a terrorising 3-year-old. Just taking some time out.
Look at that. Hypnotised chook. I wish I could do that to the kids.
The problem we've now got is that joint is so swollen that every single time Daisy tries to lift that wing, it's causing more damage. So the key here is to immobilise it. But have you ever tried to put a sling on a chicken? To bandage her wing, I do need to whack her up. Can you give me a hand? Do you want to try this, Ten?
She doesn't want to. You are now coming out of your hypnotism. Oh, hello.
Back.
You did it. Yeah.
She's got her amazed face on again.
Oh my God.
So this is going to act like a sling to support this wing of hers.
Mm-hmm.
And just mean that she doesn't have to worry about holding it up. And by doing that, it'll allow it to rest and heal really quickly. She's ready to go.
Lovely.
We want to give you these.
That's very cool.
No, there's...
So that's her work?
It is.
I think that's some sort of first. I don't think I've ever been paid by the animal that I've treated. Is that how you pay the bills? It's all right. It's fine. Thank you. That's very sweet. Thank you.
Thank you.
At the Bondi Clinic, Senior Constable Jackie Largo from the King's Cross Police Station has arrived with a very unusual detainee.
Plainclothes police brought someone into custody for a drug-related offence, and she was in a plastic handbag.
You're a fright little thing, aren't you? Little girl.
I've taken the dog off her just because she was too drug affected to look after it, so it just wouldn't be responsible to leave the dog with her.
You gonna come clean?
Police believe the person they arrested is not the owner of the puppy, but how the pup ended up in a plastic handbag is a mystery.
You put her under serious interrogation so far?
Well, no, she refused to be electronically interviewed, so obviously she's executed her right to silence and not say anything.
Going on her teeth, she hasn't started losing her baby teeth yet, so she's probably only about 12 weeks.
Yeah, I thought she was pretty young.
Yeah. Too young to be hanging out in the grass, huh? She does feel quite warm. So you said
she has been shivering, she has been shaking. We've offered her water, but she hasn't really had anything to drink, but she has been shivering the whole time.
Yeah, which is strange because she's actually really hot. The worrying thing for me straight away is the fact it's a 30-degree day outside. It must have been at least 40 inside this bag, yet this little puppy is shivering. You know there's a bowl full of it there. When they're that young, they have this really poor ability to keep their own body temperature in the normal range. They overheat very quickly and they get cold very quickly. So for her to go through this today, it's really going to push her to the limits.
Wow, that is seriously anemic. So that's the amount of red blood cells. It should be heading up towards the halfway mark.
8-year-old Safi is hemorrhaging blood. Test results have confirmed she's in a critical condition.
So she's got a blood count of 14%. Normal for a dog is above 37%. She needs a transfusion right now.
Only a few months ago, a rare disease robbed the Shih Tzu of her eyesight. Now she faces an even tougher battle.
This blood transfusion is going to make her feel better, but it is just a short-term fix.
We need to work out what's causing this hemorrhage if we have any chance of saving her life.
As the transfusion starts, Susie has to face up to calling Safi's owner in Europe.
I mean, I know it's not my fault, but it's not the news you want to tell somebody. You know, it's her baby and she just loves it to bits.
Is she a high-risk prisoner, do you think?
No, she doesn't need constant observation.
This little girl's got an incredible story. She was found in a plastic handbag being carried by someone that was high on drugs. The police have arrested her and found this little puppy. It's 30 degrees today. You can only imagine how hot it was inside this bag. Her temperatures are just on the upper end of normal there, so
Okay.
she's certainly warm, but it's not to the stage where we need to be worried about
Oh, good. Yeah.
her being affected by heat stroke or anything like that. I'm just going to scan her for a microchip. Yeah. So, I mean, it says it all, no ID found. And it's upsetting to think that there's an owner out there that knows she's missing but has absolutely no way of finding out where she's gone. Without that microchip, all you can do is hope. This one hurts.
She may not like it, but this microchip will ensure the puppy's identity is never a mystery again.
Okay. Yeah, it's okay. It is. It's going to be all right.
But there's still one last thing this little girl needs, and that's a name.
Famous girl in the cross. A little Tilly.
Tilly? Could be Tilly.
She looks pretty divine. Tilly Devine was an infamous madam at the King's Cross during the 1920s, and since this little puppy was found in the cross and has had her run-ins with the police, I just reckon the two have a fair bit in common. So what you're saying is you're transferring custody over to me?
That's correct. No death on custody on my shift.
No pressure. We've recorded no conviction, you know. Spoke to Constable Jackie. Everything is so up in the air, so really all we can do at the moment is show her some love. You gonna be okay? Oh, don't make that face. Show her what care is all about, and hopefully in the meantime we'll get some more answers. Oh, don't make that face. If you don't mind, I'm just gonna have to insist on something.
At the Bondi Clinic, Chris has become custodian of little Tilly.
Yep, it's a mugshot.
The 12-week-old puppy was rescued at King's Cross by a quick-thinking police officer
And to the side, thank you.
after being found sweltering inside a plastic handbag.
No one can tell us who she is or who she belongs to. And Tilly, while you're eating, it's probably time to talk about your custody arrangements because Jackie never really said where you had to be held in custody, did she? I've got some ideas. And Till, happy to say you're the first girl from the cross that I've actually brought home here. But you need to know something. I'm actually not in charge here, all right? There's someone you'd probably refer to as the prison warden in here. George and Tilly have a lot in common. George was rescued by the police. He was dumped in a cage in the ocean down at Bondi. So the problem that we've got right now is the fact that we're battling hypothermia and was rushing to me late one night, essentially blue. He'd nearly drowned. And so it was the police that saved his life. And with little Tilly, it's the police that saved her life as well. George, that's not a welcome. He's gone. Till, don't take it too personally. He was like that with me when he first met me too. And we get along fine. Wink. No. What are you doing? Yeah, I know. You never do this. No. George, sort that out. Sort it out. You're in charge around here. Sort this out. George. You're just going to stand there and watch it. I really should have thought about this more, shouldn't I? George is proof that even if you do have a rough start or a rough patch in your life, then with a bit of love and a bit of care, things can turn around. Can you sense the distance between us? It could be about as close as we're going to get. He's not thrilled.
Sleep now, Bubby. Good girl.
8-year-old Safi is in a critical condition after losing a huge amount of blood.
Bowel cancer could definitely cause the symptoms that Safi's had, so I'm really hoping that's not what we find. An endoscopy is basically a fibre optic cable with the camera on the end, and we can use that to put down Safi's throat into her stomach and also up her back end to have a look at her colon. This is a really big concern. The lining of the intestine is looking really quite lumpy and irregular. It should be really smooth and even, and doesn't look very good at all.
No more abnormalities are found, and now the biopsies will be sent for analysis.
We didn't see any obvious tumours or polyps or anything like that. She's got through the procedure okay, and now we just have to keep our fingers crossed. She's up here.
Oh, hello, gorgeous.
Safi's distraught babysitter Susie is now finding it hard to cope.
Nothing seemed to be straightforward. It just seems to be endless tests and maybe not even good results at the end. That's what I'm really worried about. I know it's not my dog, and in some ways it makes it worse.
Okay, Mel, you know why she looks so good?
Why?
Because it's not cancer.
Oh, that's so exciting.
That's good.
At Sash, it's great news for Safi. The little Shih Tzu was in a critical condition when she was rushed in, bleeding dramatically from the bowels.
Yeah. Want to go home? Want to see Susie? Hey? The most probable cause of Safi's hemorrhaging was either something that she's eaten or a really bad infection. It's such a relief that Safi doesn't have cancer. The poor little dog has been through so much with her blindness and other health issues, and it's such great news for Susie and the rest of the family that Safi's going to be okay.
Hey, there's my little Safi. Hello, lovely gift. Hello. Oh, look who's here. Look who's here, lovely. It's just been too much, and we're just really excited that she's coming home again at last.
Susie and her four-legged family will continue to look after the rejuvenated patient.
All the other little doggies were so excited to see her at the gate and jumped all over and gave her lots of kisses and gave her a huge welcome.
Safi, there you go.
As for Safi's owner, she's on a plane heading back home.
It's a great relief. We're really happy. It's fabulous. Absolutely fabulous.
Oh, one nice big family again. Yes. Oh, big kiss. Big kiss, kiss.
Later that week at the clinic, while Tilly's having a little nap,
Thank you. Okay, bye.
there's a welcome phone call for Chris.
That was Constable Jackie from King's Cross Police. So an owner has come forward, contacted them, who apparently owns Tilly. So she's coming in now. I don't really know much information about her. The police are happy for her to pick her up, and if they're happy, then I'm happy. Got someone here for you.
Hello, Abby.
It's Abby.
Yeah, Abby.
I've been calling her Tilly. Oh, she's happy to see you.
It's been horrible. I've been so worried about her. Yeah, I'm so happy to have her home. She's safe and well.
This is the first time I've seen her really just truly content.
But just how Tilly ended up in the cross in that plastic handbag remains a mystery.
A friend had her for the morning, and then some problems happened and they lost her.
As for the person who was found with Tilly, police have decided not to press charges.
Considering everything that Tilly's been through, it's really nice to know that she has an owner that loves her, and she's going home with her. And, you know, sometimes, as Tilly knows, what happens in the cross stays in the cross.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.